Hi, everyone. This is Sean with the Massachusetts Weekly Public Health Report here for Friday, November 20th, 2020. So let's jump into it because sometime today, Massachusetts will pass its 200,000th COVID case since the beginning of the pandemic. So let's see where things stand. Last week, we had about 26,000 estimated active cases in the Commonwealth, and this week, it's about 34,000 as things continue to rise here. The cases last week or the possible cases due to exposure from people in quarantine was about just under 7,000 people undergoing quarantine. These are not confirmed cases, of course. And this week, that number has jumped to just over 8,000. Additional 8,000 people are currently quarantining due to COVID exposure or potential cases. In terms of confirmed cases, this is where we stood last week with 25,000 people in isolation, and now that has jumped to 33,000 and change as cases continue to rise. So looking at who is becoming effective right now, so on the left shows the people who are currently confirmed cases on the by age demographic as of last week. On the right is where we stand this week. So every demographic is, of course, on the rise. So younger people are really jumping up there. We are seeing less spread among elderly populations, but that is still spread everywhere. This kind of things are kind of rising across the board. The general arc has not changed much. As you can see on this slide, where it is more or less the same breakdown of age demographics that this shows from the beginning of the pandemic, week by week, what percentage of confirmed cases any given age group is, with the youngest on the bottom. And as you can see, we're more or less the same as where we were last week, perhaps a slight uptick in the 50 to 59 year demographic, but everything else, it's all within 1% there. So to just break those numbers down clearly, the average age of new cases in the last 2 weeks remains 38 as things stay constant as there's just general spread across the age groups. In terms of hospitalizations, the average age of hospitalizations is down 1 year to 66, and the average age of deaths is up 1 year to 81. And speaking of hospitals, we had a significant increase in hospitalizations this week, with about 250 additional people in hospitals around the country, around the state right now. And remember, during the worst part of the pandemic, our maximum number of people hospitalized was 3,965. So we still have a long ways to go there, but it is a disturbing uptrend there. Additionally, there are 30 additional people in ICUs and another 7 people put on ventilators in the last week. So looking at the contact tracing side of things right now, the average turnaround time between a test being administered and the results getting to the Department of Public Health has increased. It's now this change there, in the scale that we're looking at here, 0.09 days is not a whole lot, but we are getting to the point where the average test is taking about 2 days to get back to the Department of Public Health, plus the extra time needed to get the report to the actual person. This is very much slowing down our efforts here. As we can see, looking at how the contact tracing program is going. Now it looks like our contact tracers did have a surge there in the last week, increasing the number of people who receive their notification within 1 day from 57% of cases reached in the first day to 66. So that's good. They're making positions there, but it's still, a third of people are not getting that contact right away there. Which slows down isolations and can lead to more spread. Now, hopefully people who are being tested are quarantining themselves, but of course, if someone is tested for screening rather than because they've had exposure, say, for example, someone who gets tested regularly for work, they have no reason to quarantine until their test comes back. They're going to still be going to work during that time and could very lead to more spread there. Part. So where that spread is happening, let's look around the state here. These are the average daily rates of new cases per 100,000 people. So it's generally gone up around the state. The average was 20.7 new cases per day per 100,000 people, and it's jumped up to 29.4 in just the last week. So it's a huge increase there. As you can see, Bristol and Essex are seeing the highest spread right now by population, and those are pretty populous counties as well. But we're also seeing a lot around the state as well. Hampden and Worcester have also seen big gains lately. And now some places like the Dukes, Nantucket area have seen the highest by population, but those of course very small areas. But then again, Franklin County is also very small and has seen the least. So it shows how when something gets into an area, small one, it can spread rapidly. And looking at that, to see how much these tests are coming back, here's the percent positivity. Now here's where things stood last week of communities that are, what percentage of tests are coming back positive in any given community. As you can see, last week we were at 2.29% with a lot of spread, especially in the southeast, around the Springfield area, around the northern border there with New Hampshire, and just outside Boston, just to the north there were some of the biggest areas where multiple communities having high percent positivity rates. And here's where we stand now. We see a lot of more spread in the Berkshires. We see down here, and this is northern Worcester into Middlesex County there. There's a big corridor right there. And some of the areas we saw before continue to stay pretty high in percent positivity. And the overall percent positivity has jumped from 2.29% to 3.05. And of course, these are percentages, so those numbers sound very small, but that is still a pretty big leap there. You can see anything that is in those darkest two shades of blue on this map are going to be doing a trend much higher than the rest of the state on average. All right, so looking at this one other way though, that dark blue line in the middle is what our percent positivity has been in general. But we have to account, of course, as we do every week, for the higher education testing, which is the light blue line at the bottom. Those are more screening tests for a large number of people who have not had exposure that we know about. So those are more likely to come back negative. So the orange line is what our percent positivity is with that higher education testing removed. And you can see with that going on, we are actually doing a lot worse than we might seem otherwise. Now there is a slight downtick at the end of there, but always be cautious about things like that at the end of a chart like this, because there's usually incomplete information in the latest couple of days. So that may in future charts just trend upwards. And speaking of higher education, just a quick look at how they're doing there. So this is the amount of testing that is being done for higher education versus the rest of the state, with the higher education in light blue. You can still see it is composing a significant portion of the testing we're doing around the state, whereas this is the amount that's coming back in terms of positive cases. Now, as you can see, there has been an uptick in positive cases in colleges and universities as this little light blue layer of frosting on the top here has increased. But by and large, that's not where most of the cases are coming from. They're coming from community spread. Just looking at the raw numbers on our colleges, there were 772 new cases in higher education areas, which was just 566 last week. So a definite uptick there with a slight increase in testing as well. Last week saw 216,000 tests conducted in higher education areas. And this week we've trended upwards a bit. So we're doing more testing, but there's still a lot more cases coming out. Now, not a huge number spread across all the colleges in the state, but still just showing that things are going to be ticking up. And when people leave for the end of the semester or for Thanksgiving, we'll be spreading those around, and people will be going perhaps to areas that are currently having more spread, and this is going to make a lot of complications for colleges going forward. So where we stand for the state overall, this is the 7-day average of new cases per day. And as you can see, this is how it has significantly spiked in the last couple of weeks. Back in September, 2 months ago, we were seeing less than 500 new cases per day. And that remained a slight rise, but not too much over the month of October. And then in mid-October, it just kicked upwards, started increasing, briefly plateaued, and then started increasing even faster in the early days of November to where we are now with just under 2,500 new cases per day on average. So another way to look at this is a graph of the total cases that Massachusetts has seen. This is going back to the beginning of June when we first crossed over 100,000 new cases. And as you can see, the average, this is total number of people infected. This is not per day. This is the number of people who've had an actual positive test. So at the beginning of the summer, we stood around 100,000 people, and it stayed pretty slow growing. But then, we started to kind of pick up in September and August. But it's worth noting that we reached 150,000 basically at the end of October. And right now we're almost at 200,000. Just how much growth we've had in these last 3 weeks as compared to the last 3-4 months almost there. It's been, we've seen several months of growth in the last couple of weeks. And that just something to just think about there as we go into holidays. One last thing is the space I want to save here for future updates. So there won't be a new update next Friday due to the holidays, Thanksgiving. But this is the current incidence rate per 100,000 people. And we are expecting there will be a lot of people who will travel for the holiday, for Thanksgiving, and people who may be exposed to COVID in other places or may bring COVID other places. And we may expect to see this jump up. So this is a snapshot of where things stand right now. And in 2 weeks, we'll look at it again, and the week after that, and see how the counties have fared following the Thanksgiving holiday. All right, and one last thought before we go into the weekend, just for those of you considering a Thanksgiving gathering, remember always to try to stay with immediate family rather than traveling, as the CDC recommends. And if you have a bubble, this is something to just keep in mind. This is the bubble you think you have, but remember each person has their own little circle as well. And these bubbles can rapidly lead into chains. So you have to be very careful knowing about exactly who's in your bubble and who's in your bubble's bubble. Because this can easily spread out and give you a link that can bring COVID inside your bubble. And for more of the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands. We'll be here if you need us. Stay safe.